Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. I'm joined this afternoon by Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are pleased to be able to join everyone this afternoon to provide you an update on where we stand with respect to the COVID-19 situation for the entire state of Maine for today, Thursday, March 4th, 2021. Right now, across the state, Maine CDC has received reports of 45,227 total cases of COVID-19, representing an increase of 136 cases since yesterday. Of those, 35,507 are confirmed and 9,720 are probable cases. 705 people have died with COVID-19 since we first began our work on the pandemic well over a year ago. Cumulatively, 1,549 people have been hospitalized, and just in the past 30 days, 94 people have been hospitalized. Currently, there are 69 people who are in the hospital with COVID-19. 23 of them are in the intensive care unit, and 8 of them are on a ventilator. There are 2 outbreaks that Maine CDC has just opened epidemiological investigations into that I wanted to take a second to note. One is at the First Pentecostal Church in Livermore Falls, where we are aware currently of 11 cases of COVID-19 associated with that church. The other is an investigation that we've just opened officially into the Penobscot County Jail, again, an epidemiological investigation into the Penobscot County Jail, where we've detected an outbreak comprising 10 staff members. We've been in touch with the sheriff as well as others at the jail to make sure that they have everything they need to take care of the situation. The same goes with the church. Turning now to some updates on where we stand with vaccines and vaccinations. Cumulatively, there have been 375,596 COVID-19 vaccine doses that have been administered across the state. Of those, about 244,700 are first doses, and as of this morning, 130,898 Maine people have completed their COVID-19 vaccination series. That's about 9.74% of the population across the state that has received or completed their entire COVID-19 series. Also, as of today, and something I mentioned on Tuesday, but as of today, administrations of the J&J vaccine are reflected in the, quote, final dose numbers that are available on the Maine CDC vaccination dashboard. That starts today, given that the vaccine has arrived in the state Tuesday and yesterday and is starting to be administered. Let's turn our eyes to next week. We have gotten our confirmed allocations for the portion of vaccine that the state of Maine allocates to providers across the state for next week. And that allocation looks as follows. Maine will be receiving 17,550 first doses of the vaccine manufactured by Pfizer and 13,700 first doses of the vaccine from Moderna. States are not receiving any J&J vaccine next week. As I mentioned on Tuesday, we've been working with and speaking with our colleagues at the federal government. We knew that there would be a decrease in the allocation of J&J after this week. Next week, unfortunately, the state of Maine and all the other states will not be receiving any allocation of J&J vaccine for our distribution to providers in the state. In total, that means that Maine will be receiving 31,250 first doses that will be coming into the state for our distribution. That does not reflect what may be separately being distributed and allocated by the federal government to retail pharmacies and federally qualified health centers in Maine. We usually find out about what that allocation looks like a few days from now. But to put that number, 31,250 first doses coming into the state next week. To put that in perspective, That is unfortunately 10,000 fewer doses that will be coming into the state next week for our administration compared to this week. We're going to make things happen, as we always do. For example, this week alone, we are redirecting doses from Walgreens, about 1,170 to be exact. We're redirecting those doses from Walgreens. These are doses that were not going to be immediately used, and we are going to be moving them to places where they can be immediately used. But the fact that next week, Maine will be receiving about 10,000 fewer doses than we did this week poses challenges. We are all hoping that as March rolls on and we go into April, let alone May, the overall supply of vaccine will increase. That will, of course, help the speed with which we can vaccinate folks in Maine. But for next week, it will be a challenge. And let me close by talking a little bit about where we are with respect to testing for COVID-19. Let's start with positivity rates. The PCR positivity rate on a 7-day moving average now stands at 1.26%. And the testing volume stands at a robust 715 PCR tests for every 100,000 people. Folks may recall that a few days ago, I started to express some concern because we were seeing a leveling out of the positivity rate and even some early signs that it might start turning back upward. That positivity rate has continued to level out. And the fact that it's not turning back upward as of today is a welcome sign. But we continue to pay very close attention to that positivity rate because we know it's a marker for the overall transmission that may be happening across the state. And finally, one other note on testing. As we've talked about at these meetings, Maine has been sequencing positive samples of COVID-19 across the state over the past several months. This sequencing allows us to understand the various variants that are circulating and being transmitted across the state. Indeed, Maine ranks as among the top states for the percentage of positive samples that we ultimately sequence. As a result of that work that we've been undertaking, we've just detected the first instance of the B1351 variant in the state of Maine. This is the variant that was first initially described in South Africa in December of 2020. We have just detected the first instance of that variant here in Maine. Now, detecting variants of this sort, whether it's the B117 variant that first detected in the UK that we've also found in Maine, or the 351 variant first identified in South Africa, detecting variants of this sort is not unexpected. Indeed, because Maine ranks among the top states in the percentage of positive samples that we do sequence, it's not unsurprising that we would find them. Indeed, what we've seen throughout the pandemic is that in public health and in life, when you go looking for things, you find them. And that's the situation here. We've been diligent and deliberate about setting ourselves to understanding which specific variants of the virus are circulating in Maine. And thus, because we've gone out deliberately to search for this variant and all others, it's not unexpected that we would find it. Now, what does any of this mean for you? Well, I think there are two big things. The first is that the presence of variants of this sort, like the one first detected in the UK, and now the one detected initially in South Africa, the presence of variants of this sort underscore the need to keep up with common sense public health measures, like wearing a mask, like making sure you're remaining physically distant as much as possible. The common sense public health measures that have gotten us this far in the pandemic will continue to be some of the safest things that we can all put into place to keep ourselves and our communities safe as variants of this sort may continue to be detected. The second thing I think this means for you is when your turn for vaccination comes up, don't say no. In light of the variants, in light of what we see happening across the globe with COVID-19, When it is your turn to be vaccinated for COVID-19, please, please make sure you take that opportunity and get that vaccine, because in light of these variants, being vaccinated plus keeping up with common sense public health measures like masking and physical distancing remain the best things that you can do to keep yourself safe, to keep your family safe, and to keep your community safe. So with that, I'd like to turn things over to our colleagues in the media for questions. Commissioner Lambrew and I are happy to take questions on any topic you may have. The first question for the afternoon goes to Eric Russell from the Press Herald.
Thank you, Dr. Shah, Commissioner Lambrew. I have two questions, if I could. The first question is a bit of a clarification on yesterday's announcement regarding teachers. The information, as I understand it, indicates that the retail pharmacy program is going to exclusively offer its doses to teachers. But does that go the other way? By that, I mean, can teachers use other options that aren't in the retail pharmacy program? Could a teacher go to Maine Health or to Martin's Point or to Intermed or some other and try to get an appointment there?
Sure. I think I'll begin by saying yes, over time. To go back a little bit, last week, Governor Mills announced her age-based approach to our vaccination eligibility with a focus on risk, recognizing that with limited supply, we wanted to target those people at most risk of serious illness or death. We maintain that approach to vaccination. What we learned 2 days ago is that President Biden, with the announcement that the US will get enough vaccines to give a dose to every adult by the end of May, he also in the same day said that it is a directive that in all states, in all places, teachers as well as other school staff and childcare would immediately become eligible. The president's directive also said to those pharmacy chains that are getting doses over and above the ones that Maine allocates. In Maine, that's Walmart's, Walgreens, and Hannaford's. They must exclusively offer all unfilled appointments to this new eligibility group. It doesn't mean anybody who has an appointment now gets it canceled. They will continue to honor those appointments, but any new appointments get offered to this group. But the directive does say to all providers receiving federally procured COVID-19 vaccines that they should, in parallel, side by side, make this new eligibility group of school staff and childcare workers eligible alongside in Maine, people age 60 and older. But it will take some time for our systems to get both the scheduling system set up, as well as get the vaccine doses. As Director Shah just said, we are actually getting less doses next week, not more doses. We are hopeful that the president's announcement of additional doses coming our way will match the increased number of people who are newly eligible for vaccines here in Maine.
Thank you. The second question I had, and I know you guys bristle sometimes at these state-by-state comparisons, but looking at the Bloomberg News tracker, it looks like Maine slipped a little bit in doses in arms, and particularly for second doses. My calculation was that Maine is now 34th in percent of populations with full inoculation, and that seems like a pretty big slip over the last couple of weeks. And I didn't know if there's more to it or if we have some explanations for that.
Eric, you're right. Let's just start there. Commissioner Lambrew and I have discussed this. We've asked our teams to look into it more to try to figure out what's going on. You're right, and so let's acknowledge that. I think you're right, and we share that concern. Let me say a couple of things. The first, though, is that the opening of 2 large-scale vaccination sites just this week alone, one at the Expo in Portland, the other in Sanford. That we think both of those will be big steps in the right direction to help get as many folks vaccinated as quickly as possible. The other is that there are more such sites that are in the works for opening very, very shortly as well. Again, all in service of getting more vaccine shots into arms. The other thing, though, is that, again, we've asked our team to look into that. We've started to do a deeper look into whether there are shots that are sitting on the shelves. As I've mentioned just in the briefing today, when we see that happening, we try to move those into places that we know have folks scheduled. So we're taking a deeper look at this because we're not pleased with that trend either. Now, it's also important to note, Eric, that is a relative comparison. So even within Maine, we have increased just in the past 6 days the number of shots that are being delivered every single day, just in the last 6 days, to an average of about 7,000 doses 6 days ago to 8,000 doses per day today. So we're moving ahead, we're getting faster, but I'm not going to dodge your question. We share that concern too. We'd like that line to be increasing at an even steeper pace than it is right now.
Thank you both.
Let me turn next to Evan Pop.
Hi, Dr. Shah, thank you. So as announced last week, the state has moved to an age-based approach. And I had previously asked about incarcerated people who fall in the age range of those eligible to be included in the vaccine, whether they would be included. And the answer was kind of that it was still to be determined. With this new plan, are incarcerated people who are of the age eligible to be vaccinated now eligible to get the vaccine, and will they be receiving it?
Sure. So Evan, I think we've as you've noted, we've had discussions around that. The approach right now is to have individuals of that who are incarcerated or in different carceral settings be vaccinated. By age, I should say. The challenge, of course, is that doses are at a premium. That's really what it keeps coming back to. As you've just heard, we're getting 10,000 fewer doses next week than this week. So it's partly a question of when can that process be undertaken, because there are so few doses to go around, and that's what we're grappling with right now.
So to be clear, if there's an incarcerated person who's over 60, they are eligible for the vaccine now. Is that
well,
correct?
I think what I would say, Evan, is that it's our intention to mirror the age categories for folks who are in carceral settings. But given the extreme supply of vaccine, I can't, for example, say that somebody who is 70 and above right now who's incarcerated can get a vaccine. There is just such little vaccine to go around. So I think it's equally about not so much whether they are eligible, but also simultaneously when they might be able to access a shot.
Great. And kind of a broader question. As we discussed previously, you're aware of the racial disparities that can come from doing an age-based vaccine rollout. Given that, what is the state doing to address those disparities in this new plan? Or would you say that these disparities are now kind of unavoidable with the way that the plan is laid out? I guess I'm just kind of wondering, is there additional outreach being done to these sorts of marginalized communities?
Yep, you put your finger right on it. No, we don't think that the creation of disparities is unavoidable or a fait accompli or anything of that nature at all. In fact, we've tried to take steps to make sure that that doesn't happen. The way in which we are doing that is by working with different groups and representatives of different communities across the state, be they racial, ethnic, or other, to make sure they've got information on the vaccine, to make sure that when folks in those communities are in the right age tier, they know how to access it. They've got culturally appropriate resources, as well as assistance in getting scheduled. I've tried to do that on a personal note with communities that I'm more involved with. So we don't think that those disparities are unavoidable, and we are trying to work deliberately to cut them off,
and
to prevent them from happening.
Yep, and we have added to our policy that within eligibility groups, we encourage our providers to develop partners in these communities to make sure that we have a way to get to hard to reach populations, to really try to figure out whether there needs to be an off-site clinic or on-site supports. For example, when I was at the Portland Expo on Monday, we talked at length about what they are doing to get to people for whom limited English is not the first language, or for whom there's distrust in the community, and they've been working on educational material as well as social supports to get those people into vaccine clinics. So both through policy and through practice, we are working hard to make sure that racial and ethnic minorities whose prevalence of COVID-19 was higher in the early days of the pandemic get a vaccine as soon as they're eligible.
Thank you.
Before we go on to the next question, I wanted to just go back to my remarks or clarify two things that I said earlier. The first is I indicated that no states are receiving J&J vaccine next week. I I can't confirm that. I should not have said that. I intuited, and based on some conversations I've had with a dozen or so of my colleagues in other states that are not getting J&J, I intuited that no states were. That may not be the case. So I should retract that, or at least be more careful in my own wording. I've spoken with or interacted or communicated with, again, about a dozen or so colleagues, all of whom indicated that their states were similarly not receiving J&J. Maine certainly is not, but there may in fact be a state that is. The second thing that I should have been more clear about is that J&J vaccine may still be coming into the state through direct channels, be it through the pharmacy partnership or through the direct channel to community health centers. We don't usually find out about that allocation until Sundays. So we shall see on Sunday whether any new J&J vaccine is coming into the state, but I should have been more clear about that. And the third thing, again, before I turn back to questions, is a little bit of a note with respect to our Moderna vaccine for next week. We are going to be utilizing, so our allocation of new shots of Moderna, first doses, is the same as it has been for several weeks, 13,700. However, folks will remember that back on Martin Luther King Day, because of inclement weather, there were some shots that were delivered that were too cold. And we had to go through a thing where we waited to see whether they were viable, et cetera, et cetera. To cut to the chase there, we got a replacement. And those replacements are now being due for their second doses. We are taking those second doses and splitting those. And so there will be about 2,200 first doses that will be available to us on top of the 13,700 new first doses. If your head's not spinning with all those numbers, you're doing a better job than I am, but I apologize for not being more clear about that at the top. I just wanted to go off script for a second and just clarify all three of those things. So let me go back to questions, and I'll turn to Patty White.
Thanks, Dr. Shah and Commissioner Lambrew. Can you explain a little bit more about how clinics outside of pharmacies are going to incorporate school staff? In the release that was sent out yesterday, it said that clinics would start to open up slots for school staff soon, but there would also be clinics dedicated to staff 60 and older. So I guess my question has two parts. Why are the dedicated clinics for school staff going to have an age cutoff? And then for the other clinics, what rules do they need to follow? Are they free to decide who to focus on, or are there parameters to ensure there's equitable distribution between school staff and the general population that's 60 and older?
Yeah, and this is all moving fairly fast. Again, the directive came down on Tuesday evening. It was effective immediately. So we are working with all of our providers on answering many of these exact same questions. But I think it's safe to think about three different types of clinics. Number one is, again, Walgreens, Walmart, and the Hannaford pharmacies were directed by the federal government. As a reminder, their relationship is not with the state of Maine. They're getting their vaccine doses over and above the Maine allocation from the federal government. They've been directed to make all their available slots through the end of March, to make them available to our child care workers, our teachers, and our school staff. Second, all other providers, as a term of their agreement with the US CDC, also must make this new group of teachers and childcare staff and school staff eligible alongside those people who are otherwise eligible in Maine. So it's not necessarily for those other providers a priority, but it is another option, another eligibility group that will be coming in. No different than the fact that we are still vaccinating a new nurse who comes on at a hospital who is eligible under our former category of phase 1A. But then third, last week, before President Biden made this announcement about teachers and school staff, Governor Mills did announce that we did want to make sure that those older teachers, those who are age eligible, people ages 60 and older who work in schools, who teach in schools, we wanted to offer them a special dedicated one-time opportunity to get a vaccine shot, knowing that we appreciate their work and want them in their classrooms. So we are continuing with our plan that we announced before this recent announcement to hold special vaccination clinics for all older teachers and school staff in Maine. Next week, we'll have more details on those clinics coming out hopefully tomorrow.
So for the general clinics, they need to accept everybody. I mean, can they decide, we want to focus on school staff on certain days, or are there supposed to be, or will there be caps at all to sort of ensure, half doses go to school staff, half go to 60 plus?
That is not our intent at this time. We have tried to work hard with our providers to, make sure that they have some degree of flexibility. And I should note, even Walmart and Walgreens and Hannaford don't yet have open appointments. So I think that their earliest open appointments are going to be at the end of next week. So we do urge all those people who are newly eligible to have a little patience, because those slots, when they open up, are usually filled quite quickly. But we are hoping that this is just another category alongside what we have put into our plan, which is people over the age of 60. And as I previously mentioned, even within that, we urge providers only to prioritize those at higher risk, be it they're older within that age group, they may have some sort of medical condition that puts them at risk, they're disadvantaged because of race or some other structural factor. So those are the only uh, prioritizations that we allow within an age eligibility group, or within eligibility groups across the board.
Thank you.
Thanks, Patty. Let me turn to Mel Meyer next.
All right, thank you, Dr. Shah. My questions are also about teachers. With teachers getting vaccinated, could this impact in-person learning requirements or plans? Could districts change what they're able to offer?
Yep, Mel, I think the place to, we've discussed this, as you might imagine, and I think there's a few observations. The first is that's still under discussion. I think as we think about the journey that we've been on with school reopening, Maine has demonstrated that we've had a lot of success with the parameters that we put into place, even well before the federal government caught up with us. Now, with the possibility now of teachers in large numbers being offered vaccine, that does change things. It makes the classroom that much more safer and a step in that direction. It's, I think, also important to note that this as a tool toward facilitating in-classroom education is just one such tool. Dr. Walensky herself, the director of the US CDC, indicated that vaccinating teachers is not necessarily, or is not a prerequisite to having in-person education back. But we've also heard that there are concerns around things like spacing, and we're keeping an eye out for emerging data to see where that might take us.
And I will add that, the US CDC didn't put out really clear guidance last July when the state of Maine issued its own guidance. We worked very closely with the Department of Education and Maine CDC and public experts on that guidance. Its more recent guidance that it did put out in February was similar to the same types of guidance that we issued, which is confirming that what we did was the right thing. However, it's important to note that the federal guidance is also more stringent in some areas than Maine's. It includes, for example, a recommendation of a minimum of 6 feet between students who are masked at all time, while Maine adopted the American Academy of Pediatrics recommendation of 3 feet for children, which along with other protocols has been successful. Regardless of these differences, we continue to recommend that these requirements and recommendations are followed by school districts. We will watch to see if the US CDC recommends lifting any of these public health protocols over time, such as that minimum space between desks. For now, the requirements that are posted on the Department of Education website remain, and we urge school districts to look at those guidance, those requirements and recommendations, and continue to follow them, even as teachers and school staff get vaccinated.
Okay. And then my second question is, why not include higher education staff members? Could these workers be included as a priority later on?
So I'll just go back to what Governor Mills announced last week. As a reminder, her North Star is public health and protecting people's lives, as well as trying to vaccinate people as quickly as possible to race ahead of those variants that Dr. Shah just described, which have arrived in Maine. So with that in mind, we maintain our policy of moving down through the age brackets, within the age brackets, trying to prioritize people at risk, hoping with additional vaccine, we can move through those brackets more quickly. Our most recent change of aligning the Maine policy with a directive from the federal government is specific to teachers and childcare workers, pre-K as well, Head Start. We're following the president's directive. He has the prerogative to do it. He's president of the United States. He found more vaccines, where hopefully those will come in time for us to get these people vaccinated this month. But we are following the president's directive, and that did not include higher ed.
Thank you.
Let me turn now to Amy Brown.
Thank you, Dr. Shah and Commissioner Lambrew. I have a couple of, I have a question from a listener, but a couple of quick follow-up questions. First, where was the South Africa variant found?
In an individual in Cumberland County.
Okay. And just to make sure I'm clear, I know you've explained this a couple of times, Commissioner Lambrew, but I just want to make sure I understand this correctly. Teachers can now sign up to get an appointment within the pharmacy program, but unless they are within the age group that is currently open, the other providers, like say Northern Lights program, are not yet open to them, but will be at some point soon. Is that correct?
I'll say a little bit differently, that all vaccine providers in Maine going forward will make teachers, school staff, and childcare workers equally eligible with people who are age eligible or otherwise eligible for vaccination. There will be special eligibility offered, or excuse me, prioritization for those workers at those 3 pharmacy chains that are getting their vaccines from the federal government: Hannaford, Walgreens, and Walmart. The state of Maine will continue also to work with Department of Education of offering special clinics just to those 60-plus-year-old teachers and school staff, which we planned before this new announcement. So going forward, again, it's going to be a rolling basis as appointments become available, as vaccine doses become available, as systems come online. So it will take a little bit of time for teachers and childcare workers and school staff to be able to get those appointments at all sites in Maine. But the president's directive is for all sites to offer that eligibility class vaccines this month.
Okay, great.
Amy, I've spoken just since the directive came down on Tuesday afternoon. I've connected with physician leaders and others who are operating vaccination sites across the state, and they are adjusting their registration and other platforms to recognize the president's directive to vaccinate educators and childcare. But making those changes and making sure they all work, that does take a little bit of time. They've asked me to ask and let everybody know, particularly educators and childcare professionals, to bear with them. They are changing their systems to open up those lines of eligibility so folks can register. But as with any large scale system, especially one with so many moving pieces, they want to make sure it all works before they go live with it.
Okay, thank you. And a question from a listener who wants to know if it's known or what is known yet in terms of how well the Moderna and the Pfizer vaccines work against the different variants that are out there. There have been some reports that the J&J vaccine might provide better protection against the Brazil variant, and also whether or not the vaccines protect from transmitting variants. You've already answered the question about recently you were saying that people, when they're fully vaccinated, there's more and more evidence that they are not able to transmit the virus. Does that hold true for the variants of the virus as well?
So Amy, I'll take both of your questions. The first one, all 3 vaccines that we have offer exceedingly good protection, not just against the more traditional virus that's circulating, but as well as against some of these variants. The J&J one, indeed, their scores very well, given the environments in which it was tested. South Africa, Brazil, it performed very capably in both of those. But the Moderna and Pfizer vaccines also have demonstrated both in petri dishes as well as in humans that they too can protect against those variants. Scientists from all of those companies, as well as around the globe, are continuing to test their vaccines against new and different variants to make sure that protection holds. And then we'll see where we go from there. In terms of transmission, the emerging data continues to suggest that vaccines do an exquisite job not just keeping people themselves individually healthy, but also reducing their likelihood of transmitting the virus, whether it's the garden variety COVID or the variants as well, both.
Great, thank you.
Yep. Let me turn to Mike Shepard next.
Hi, Dr. Shah. I just wanted to understand the Johnson & Johnson issue next week because I haven't seen much wider reporting on it. Do you have any reason for that? Is there any indication as to what the states can expect afterward, just given the kind of reliance on these doses for the, for the national sort of sprint here?
Yep. Mike, I'm glad you asked that. So, I'm thank you for pointing out the imprecision in what I said earlier. It may be the case that no other state is receiving J&J. Again, I've only heard from about a dozen. Coincidentally, as we've been on this press conference, I got a text from a counterpart of mine in a Western state who said, hey, what's going on? We're not getting any J&J next week. So that's 13 states that aren't. So on Tuesday and through yesterday, I had the opportunity to chat with counterparts of mine at the federal level once we started hearing that the volume of vaccine for J&J that would be delivered for our allocation would not be what it was this week. And in short, here's what's going on. As part of the approval process for all three of these vaccines, vaccine was being manufactured in parallel with the approval, so that the moment the vaccine received an emergency use authorization, vaccine could start shipping. And that was the case with Pfizer, that was the case with Moderna, and it's the case with J&J. They in effect cleared out the shelves as soon as the emergency use authorization came out. And they pushed out 3.9 million doses of J&J vaccine to states, pharmacies, and federally qualified health centers this week. But as a result of clearing out the shelves, they now are ramping up their production. What we have been told is that states, at least Maine, will not be receiving vaccine of the J&J brand for next week, the week of the 8th, that we may receive a little bit of J&J vaccine the week of the 15th. And there are question marks still about whether we will receive more vaccine the week of the 22nd, and then hopefully for certain starting in robust volumes on the week of the 29th. Now, all of that is 100% subject to change, as has everything in the pandemic been, but that's the latest of the briefings I've received, and it's a function of them clearing out the shelves and now needing to ramp production back up to get more vaccine out the door.
Great. I just had a quick. I wanted to tell you a story. So last night I was working through the Hannaford system to set up appointments for newly eligible family members, and I was struck by the fact that I could reserve an appointment out to Tuesday in some locations while just providing any date of birth, 60 plus, younger. The company has said proof of employment will be required at the appointment. I know that's something the governor talked about yesterday, but I could still hold that slot for myself and an eligible person for days. Are you concerned that it'll be difficult to police all this under the governor's new plan?
You know, I'll start, and then Commissioner, please weigh in. There's a balance between over policing a system and then making sure we trust people. And we're always trying to strike that balance between trusting Mainers to do the right thing and not registering or not holding a slot if you're not over the age of 60 or you're not a child care provider or you're not an educator, versus over engineering or over policing a system that slows things down. So there's always that balance. What we try to do is to keep tabs on the situation, listen to reports that are coming in from the field, adjust if we need to, enforce if we must, but always try to keep that balance of moving with velocity and trusting people to do the right thing. And I'm sorry, well, I was just going to note, Mike, just to be sure, there's the front end registration piece, but then there's the verification that occurs at the point of service, at the point of vaccination. And there, people should be prepared to demonstrate that they are indeed 60 or over, or are indeed an educator, or a school staff member, or a child care professional. They may be asked for their ID, their work ID, or a pay stub, or anything of that nature to verify their eligibility at the point of vaccination. Sorry, Commissioner.
I was just going to add that we do have some guidance on our website about what qualifies as proof. We do give our vaccination sites some discretion about those forms of proof of eligibility. We are working, for example, on how a childcare worker could provide evidence to our vaccine sites that that person indeed does work at a child care center, because we do recognize that in these difficult times with limited vaccine supply, we want to make sure that we are vaccinating the right people. So we do have we do have these requirements that are necessary in these difficult times to make sure that people do get vaccinated in priority order.
And Dr. Shah, just a quick clarifier. I mean, was this Johnson & Johnson thing, was it a surprise to you? You said you had some indication as to, that it may be coming, or that something may be coming, at least a reduction?
After the Pfizer and then the Moderna vaccines were authorized, we saw a large volume come into the state that first week, a big bolus that came in, and then reductions in the subsequent 2 weeks while that capacity was being rebuilt. And those reductions were, I can go back and get the exact numbers, Mike, but they were on the order of 40, 50% reductions. That is more in line with what I was expecting here, but at the same time, if what it means is that they completely cleared out the shelves, then I understand why that would be the case. But I was expecting more of a reduction in line with what we saw with Pfizer and Moderna.
Thank you.
And it suffices to say, and Commissioner Lambrew and I have underscored the point, that adds to the challenge that we're facing statewide. Just from a very granular operational perspective, it means that we worked with a number of providers on the ground this week, giving them J&J vaccine, 11,500 doses, to spin them up to be able to provide as many vaccines as possible this week, utilizing the J&J vaccine, going out in the field, but now not seeing that vaccine coming back for a couple of more weeks. That's an operational challenge. Let me turn to Megan at WMTW next.
Thank you for taking my question. The president's announcement, about teachers and school staff kind of coming almost directly on the heels of the state's announcement of the age-based approach. If you look at it, it seems as though these two philosophies behind who gets priority don't dovetail. They're kind of, I wouldn't say at odds, but they're different at the very least. Two questions. Did the state have a heads up at all that the federal government was going to make this announcement or go in this direction? And do you think that this is going to complicate how the state vaccinates the groups in age-based approach?
So we learned the same day that the president announced the increased purchase of vaccines for all Americans of this new directive. I think it's, again, the president's prerogative that if you find that you can vaccinate people quicker, and as a reminder, what the president said was there will be enough doses to vaccinate all adults in the United States by the end of May, not the end of July, which is a big change and a very exciting and welcome change. We here in Maine are thrilled, as is everybody nationwide. Same day he made this announcement about this new eligibility class. We did not learn about that before that day, but I will say we will adjust. We're happy we want to vaccinate everybody. I work with childcare providers and here in the Department of Health and Human Services. We're very happy to be able to vaccinate them, as well as our hardworking teachers and school staff and bus drivers. We want to vaccinate everybody. So we welcome the ability to vaccinate more people. We're just hopeful that the actual on-the-ground doses to vaccinate another roughly 50,000 people who are now newly eligible in Maine come soon, because we really want to make sure that we keep on the schedule that Governor Mills laid out, which is trying to vaccinate people in their 60s this month, then turn to people in their 50s next month, then people in their 40s on down.
I guess, again, it goes back to a supply of vaccine. But do you think, given that, we're seeing decreased doses coming into Maine, do you think it's possible to have teachers and childcare staff vaccinated? Can we pull it off?
We will work tirelessly to get as many teachers, educators, school staff, and childcare providers vaccinated with their first dose, as the president directed us to, or in the case of Moderna with that, J&J with that single dose. Commissioner Lambrew and I are committed to working 24/7 to get as many doses into arms this month as we can.
Thank you.
Let me turn to Dustin at New England Cable News next.
Thanks, Dr. Shah. What have you heard from teachers who are seeking vaccines so far today? Have you heard much from them at all?
I can only speak for just some emails or folks who have sent notes to me on social media. I've heard I've heard a couple of things. So number one is I've had at least one or two emails and a few folks on Twitter who've indicated that they have been able, in their role as educators, to at least secure an appointment. We've heard other folks who were not able to find an appointment for a couple days out. That is to be expected. It's what the commercial pharmacy chains have communicated to us, which is that they often book out appointments for several days. So subsequent to this change, it still may take a couple of more days for new appointments to open up. Those would be the slots that would be reserved for educators and childcare providers. That may take a little bit more time, but at the same time, I have heard from folks who have said that they have been able to secure them. I think that picture will change as well as come into clearer focus over the next couple of days as more slots open up.
Now, you sort of talked about this earlier. I just want to see if we can condense it into one answer. Are all the federal partners, Walgreens, Walmart, and Hannaford, ready to give these vaccines right now to teachers?
Our ask to them, or our directive to them, was to follow President Biden and the U.S. Department of Health and Human Services directive, which was effective immediately upon issuance on Tuesday, and directed all vaccine providers to make eligible educators and childcare professionals, as well as for those who are in those fields to go first toward those retail venues. In terms of whether or when those retail pharmacies will be ready to do so, again, I've heard anecdotally that folks have secured appointments, but I would refer you to those three chains about their individual readiness.
And then what do you think teachers should expect as they go looking for vaccine appointments over the next week and a half or so? Long waits, availability? Are they going to open 5 tabs in Google Chrome and sit there? What do you think is something they should look out for as they try to get their appointment?
I can't really speculate, Dustin. On one hand, we know that our retail partners, and based on my emails and communications with them, are committed to making this work. We're simultaneously working, as Commissioner Lambrew outlined earlier, with other providers across the state to offer channels of vaccination, specifically for those individual educators who are 16 over. And so I think it will be a little bit mixed because we're not getting significantly higher volumes of vaccine. So we have eligibility, but we may not have vaccine immediately next week to match that. So that is invariably going to lead to some delays and certainly some frustration that will follow. But we also have the balance of the month. And if the projections for the volume of J&J vaccine, which the manufacturer has promised 20 million doses across the country, that is to say about 16 million doses pro rata being delivered across the states, means that that supply will increase. That will certainly help ease things. Let me turn over to Patrick Little next.
Thank you very much. I wanted to just double check a couple things, and then I have a question. I believe earlier in the briefing you said that, was it about 10%? I think it was 9.7% of the state has completed the entire series. Is that right?
Let me pull that number, Patrick, just to make sure I'm not giving you bum information. But yes, that is correct. 9.74% of the state has completed the series, by which I mean they've either received both doses of Pfizer or Moderna, or received their single shot of J&J.
Okay, terrific. And regarding the variant, this was the variant that was first identified in South Africa. You mentioned that this was not unexpected. How many cases of the UK identified variant have there been in the state? Are we still at 2?
We actually have now identified a third case. So we are at 3 cases of the UK variant and this 1 case of the 351, or the variant first described in South Africa.
Okay, terrific. You've touched on this a little bit already, but I would like to sort of gauge the confidence that the state has now in being able to stick with the age tiered system now that we have this new directive to push teachers to the front of the line. Is the state still confident that it's going to be able to get to people who are in their 50s next month and who are in their 40s in May and so on? Is that still realistic at this point?
We're hopeful. We are hopeful that the Biden administration does indeed get some of these vaccine doses from any of these approved sources as soon as possible, so that that flow of vaccines to the state of Maine comes to be able to accommodate this. So we are going to closely monitor to track and make sure that there are no unused vaccines in the state, so we can really be moving simultaneously to meet the president's goal on teachers as well as the governor's goal on older Mainers. So we will continue to hold tight to that plan, because we do appreciate that people do want some degree of certainty. They kind of want to know when they can expect to get their vaccine. So we're going to hold to this schedule for now, but closely track and monitor as time goes by.
Patrick, the future with respect to the overall supply of vaccine, the future is bright. The partnership that was announced on Tuesday with Merck, whereby because Merck's initial vaccine candidate didn't show promising results, they're going to be utilizing their production capacity to make J&J vaccine. That's incredibly promising and should really go a long way toward accelerating the volume of vaccine that was initially supposed to be delivered by the end of June or the end of July. That may accelerate that pathway. It's also important to note that there are at least 2 other promising vaccine candidates in the development and regulatory pipeline, one from AstraZeneca, another from Novavax. Both the addition of either of those, let alone both, would also help speed things up significantly.
Okay, thank you very much. I appreciate that.
Yep. Let me turn over to Rose from the Maine Monitor.
Hi, thank you for taking my questions today. I'd like to ask about the local volunteer task forces that formed around the state to respond to the pandemic in their communities. I was wondering what difference, if any, did these kind of volunteers group make in responding to the pandemic, particularly those serving the new Mainer communities?
Sure. Rose, we'll get you some more information about that and try to get you more specifics. But in general, and I'm glad you focused in on new Mainer communities and other groups that that have been affected in difficult and different ways. In those situations, volunteers have been able to come together to do a couple of things. The first is to work as navigators, to help members of those communities navigate the pandemic, whether it's through testing, whether it's through getting information about what's going on, and now, of course, in connection with vaccines, figuring out the easiest ways to access vaccine when their age tier becomes eligible. The second thing, though, is, and I think really vital for us, they have been an invaluable partner in forging a connection with those communities. It's difficult for folks in general to interact with and understand what's going on in a pandemic in general, but certainly as it relates to one where the Maine CDC, Maine DHHS are all involved, and it starts to become dizzying and who's doing what. Those groups have become a vital link between the work that Commissioner Lambrew and I do and those on the ground. They are able to voice their concerns and give voice to the concerns of their members to make sure that we are hearing them. And we too, in turn, can talk with them about the policies and programs we're putting into place so that their members and their folks on the ground can take advantage of them.
And I'm just going to add that volunteers are clearly valuable, but we don't necessarily just rely on volunteers. We have been supporting these organizations because the work is valuable to the state. So we have the Health Equity Improvement Initiative that we announced last summer that provided $1 million to many of these ethnic community-based organizations to be providing social support and services. We continue to develop partnerships with these organizations to have them support our work in vaccination. So we'll hopefully be able to announce those soon too. So volunteers are part of the picture, but we also value the work that these organizations do on the ground and have been supporting them, through our grants and contracts as well.
What my second question is, what role do you think these kind of task forces could play in public health even after the pandemic, if anything?
That's a good question, Rose. I don't, there's various in different ways. I think in some level they can continue with that same representation and navigation work that they've already been undertaking in the pandemic. Let's not forget that even though there's a pandemic of an infectious disease raging, other concerns in public health, be it substance use disorder, behavioral health, and other chronic conditions like diabetes and hypertension, are still omnipresent. And coalitions of that nature, volunteer task forces, can continue doing the same work, but just with a different disease or a different health concern as part of their focus. And so that's something I'm very interested in exploring with them.
Thank you.
Thank you. And the final question for the afternoon goes to Morgan from WABI.
Commissioner Lambrew, Dr. Shah, thank you for taking my questions today. My first is I'd like to ask about the vaccinations and all adults getting their first dose by the end of May, sort of echoing Megan. Can we pull that off? I know that there was the governor's call. You talked to different colleagues around the country. Are there statewide strategies going on here? Are other states or other of your colleagues thinking that this is going to be possible? Can we administer all Maine adults by their first dose by the end of May?
Well, in similar fashion to vaccinating educators and childcare professionals, we're going to work tirelessly to vaccinate as many Maine people with their first dose, let alone their completed series, as quickly as possible. If that's the end of May, great. If it's sooner, even better. It may not be by the end of May, however. There are so many things, for example, vaccine supply, which still remains at a premium. And so we are waiting to see what that supply pipeline looks like, and then simultaneously trying to build as much vaccination architecture as we can here in Maine, so that when we start getting more doses, which we're expecting, we've got vaccinators ready to go to get them into arms. I can't make a promise as to when that project will be wrapped up. We're encouraged by the Biden administration's aggressive plans to get more vaccine and to get it to states. But at the same time, right now, for example, for the foreseeable 6, 7, 8 days, we're still pretty vaccine constrained.
And just one follow-up for that, is that state registration site, is that any progress with that?
We're making steady progress on 2 fronts. The first is on the website piece, and then on the phone bank dial-in piece. Where we see this type of registration platform being of the greatest value will be the new vaccination sites that we are bringing online. Many of the larger established vaccination sites, like for example, the one in Scarborough Downs, the one at the Cross Insurance Center, those very established sites may opt to continue utilizing the registration platform that has worked for them and has enabled them to get to 1, 2, 3,000 shots a day at those sites. But for newer sites that are coming online, as well as other sites that we've heard from that are themselves struggling with their own suboptimal platforms, for those sites, this platform will be of help.
And then I just had a question about nursing homes. Now that nursing homes, staff, residents are vaccinated, are they able to discontinue wearing masks among themselves? And if somebody were to be vaccinated, would they be able to go at some point visit their loved one at a vaccinated nursing home, long-term care facility?
I would urge caution on the former with respect to removing masks within nursing homes. Even though many have been vaccinated in nursing homes, really, many doesn't cut it. It really needs to be all. And in a nursing home where there's new residents coming in, there's new staff coming in, you may not know on any given day whether every single person in the building has been fully vaccinated. And so in nursing homes, we're not changing our guidance. In fact, in healthcare facilities in general, we're not changing our guidance. Maybe even in other facilities for right now, we're not changing our guidance, whether it's a restaurant, a nursing home, or a hospital, because you never really know right now, given that vaccines are still supply constrained, who and making sure that everyone has been fully vaccinated, because that's really where we need to be. With respect to those who have been vaccinated themselves going to visit, there's a lot of work being done at the federal level to think about visitation. The US CDC has started to signal and release some guidance. They did so today. I think there's a lot more to come on that, Morgan, in the coming days and weeks.
And on that visitation point, we did issue guidance even before the vaccine was released on how people can safely visit their relatives, their loved ones in nursing facilities. It can be done safely with masking, with that kind of physical distancing, with the appropriate protocols in a nursing home. And we did tier that visitation guidance by the local positivity rate. And the good news about Maine right now is our positivity rates are relatively low. So there are opportunities, even without a vaccine, for people to visit people in nursing homes with care.
Mhm. Very good. Well, thank you all for your questions this afternoon. And for those of you who have taken some time out of your afternoon to join us and tune in, thank you. As you have throughout the pandemic, we appreciate you dialing in, tuning in to hear the latest on where we are and where we hope to be going soon. We look forward to talking with everyone very soon again to talk about again where we are with respect to the pandemic. But in the meantime, as always, please be kind to one another and take care. We'll talk with everyone soon.